Hi, my name is Tim Hill and my company is Utonic, and in this video we're going to discuss nerve glides for the arm and the shoulder. So the first part of the video is basically to try and help you identify which nerve it is that's causing you a problem and how you then might go about trying to treat it. If you look in the comments, I'll list where you'll find each nerve glide in this video. So the first one is the axillary nerve. So if you're getting problems maybe around the shoulder, or sort of anywhere between the neck and the shoulder, or potentially back on the back of the shoulder, that's the axillary nerve. So if you look in the playlist below, you'll find a glide for that one. The next one is your suprascapular nerve. So that supplies muscles called supraspinatus, so which locates up there in a little groove in the shoulder blade. Okay, so common pain referral pattern for that is just basically sort of up into the shoulder as well. It also supplies your infraspinatus muscle, which is on the back, so it's one of the rotator cuff muscles. So again, sort of any pain around there, into the shoulder, back of the shoulder and top of the arm, have a look at the glides in the video below. The next one we're going to look at is the median nerve. So this one basically primarily innervates the forearm wrist flexors. So it's sort of muscles of the forearm. Basically it comes down to, in terms of, you may get a bit of numbness or change of sensation in these three fingers, so in the thumb, the index finger and the middle finger. So again, have a look in the playlist for the median nerve. The radial nerve innervates the triceps, so on the back of the arm, and also the wrist extensors. So again, another common referral pattern is the back of the hand for this one. So it could be anywhere along the back of the arm, back of the hand. Then the next one we're going to look at is the ulnar nerve. So say if you're getting some numbness in those two little fingers, in the ring finger and the little finger, and again back of the arm, sort of up, sort of inside the arm. It's sort of say, in terms of the muscles that it innervates, they run up here, so on the inside of the forearm. And then lastly, the musculocutaneous nerve. So that would be, say, into the biceps, or possibly if you have problems trying to turn your hand over, which is supination, that could be the musculocutaneous nerve. So have a look at the glides in the playlist below and see which one is relevant for you. The axillary nerve glide. So the axillary nerve supplies the deltoid and a little muscle on the back of the shoulder blade called teres minor. So with that one, a very simple way that you can try and get it to glide if you're getting a peculiar referred pain that's not really palpable, it's very simple. So you just lift your shoulder up, take your head away, and then side bend, and then just draw the shoulder down. And then again, you just come back to start. And with these, I'd maybe look at doing, say, about 5 reps. So again, so it's shoulder up, head over, then turn your head, and then just try and draw your shoulder blade down. So try and keep these all pain-free. So again, show you one more time. So it's shoulder up, head over, and then again, draw the shoulder down. So as I say, so if the nerve's trapped, nerves don't like being stretched. So the idea is, what we're trying to do is just get the nerve to move through the tissues. So try and do it within the bounds of pain, and as it settles down, you can then maybe try and look at trying to increase the range of movement. So give those a go, and hopefully it will give you some relief. The suprascapular nerve. So this nerve supplies primarily your supraspinatus muscle, which resides in here, in a little groove in the shoulder blade. So there's one way that you can try and get into that and actually give it some self-massage, which is particularly tight, is put your fingers in there and then use a foam roller. So what you do is put your fingers over there, the foam roller over the top, and then lean into a wall, and that way you can actually try and get a little bit of relief and just do a little bit of massage into that area. So it also supplies your infraspinatus muscle, which is on the back of the shoulder blade as well. So again, similarly, if you put the foam roller up against a wall, then you can try and do a little bit of self-massage into that region as well. What you need to do in order to glide the nerve is take your head over to one side, take your arm over, bring your arm back, and then take your head back. So it's quite common to get a couple of little clicks when you do this. So I wouldn't be too nervous about it, as long as it's not accompanied by pain. But say sometimes it's just the facet joints can get a little bit stuck. So what I would do is I would do both sides whenever you do this one, because say sometimes what you've done, you've actually increased the range of movement on one side. So I would do the other side even if it's not affected. So again, you just take your head over, then side bend. So you just take your head over, then take your arm over, bring your arm back, and then your head back. And again, 5 reps on each side. And it should be pain-free. So I say it's not uncommon to get some noises in the neck, but as long as they're not accompanied by pain, then I wouldn't be too concerned. And then again, after you've done those, it's a good idea also to just do some rotation and some side bending, because you might actually find that it's just a little bit of stiffness in the neck that could be causing it. So again, just each time, and then your side bending. And what you'll often find is, as you do more of this, one will actually influence the flexibility of the other. So as you rotate, you're stretching the muscles, and as you side bend, you're also stretching the muscles. But say, yeah, and then you can also go back and repeat the exercise again. So that is the nerve glide for the supraspinatus muscle. So in this video we're going to look at the median nerve glide. So the median nerve supplies primarily the forearm wrist flexors. So often it's these 3 fingers here, so the middle finger, the index finger and the thumb. So it might be that you're getting a bit of numbness in those fingers. I often do when I'm cycling. Okay, and it's a very simple glide for this one. So first of all, if you have got quite tight wrist flexors, so you've been doing a lot of typing, driving, all those things where you're gripping, or using a mouse, you might find that that's quite tight. So a good way you can actually try and release those muscles is very simply just using something like a foam roller, and just literally just running your arm down the roller. Or you could use a massage ball. So you might find it easier to actually do this more on a kitchen countertop or something like that. And again, just basically using as much pressure as you can tolerate, really. Then in terms of the glide, it's very simple. So it's just basically you're circling the wrist and trying to rotate your palm outwards. So that's one glide, and what you should feel is it should start to ease up. So again, so if you're a cyclist, then you're getting numbness in those fingers. So often you cyclists will tend to shake their wrists out, but try and think about that. You may also find that circling the wrist beneficial. Okay, then also there's a nerve glide that will actually tension the median, the ulnar and the radial nerve, which you can just do by holding your arm out to the side. So fingers pointing down and then side bending. So it does catch the radial nerve and the ulnar nerve, but they have similar pathways basically, so it's often a good idea to have a go at that as well. The radial nerve glide. So the radial nerve primarily innervates the muscles on the back of the arm, such as the triceps and the wrist extensors. So, and also sometimes if you're getting an altered sensation on the back of the palm, then that could be the radial nerve as well. So there's a couple of ways you can try and glide this one. So one is taking your arm out to the side, fingers pointing down, and then just side bending your head from side to side. Another one is rotating the whole of the shoulder and also the wrists. So you have to think, so in terms of that's radius over ulnar, so that's rotating my wrist, but also try and rotate and bring your elbows up. So elbows pointing towards the ceiling, elbows pointing towards the floor, and again turning the wrist over as well. and you can also traction the nerve a little bit more by lifting your head and lowering it. And then we've got one more, a variation on the waiter's tip. So you start with your hand in front, and then bring your shoulder up like you're cradling the phone, head down, and then take your head away and your hand behind. So shoulder up, head down, and then head away, hand behind. So all the time keeping your palm facing upwards. So that is for the radial nerve. The ulnar nerve, Clyde. So the ulnar nerve affects the flexors and on the inner arm. So it's in here, and often, say if you're getting a change of sensation in your fingers, it'll be the little finger and the ring finger. So an easy version is to bend the little finger and the ring finger, and then bend your arm, straighten your arm, let your head drop, and then look up. So this one might give you some relief. And then if you want to work it through a fuller range, so if it was more acute, you might want not to do the second one until you've done the first one. And the second one is trying to make basically a monocle. So you're turning your hand over, and you're trying to get the little finger and the ring finger on the side of your face. And then from there, if you want to stretch it a little bit, you just side bend over. So you make that monocle, so turn your palm back, so your hand is essentially upside down, palm is facing towards the ceiling, and then you side bend. So again, it's rotating, turning the palm over, back towards you, make your little monocle, and then side bend. So that is the ulnar nerve. But if this one causes a problem, then I'll stick to this one first. And then when that starts to free up and get moving, then you can maybe try the second one. So the musculocutaneous nerve. So this one primarily innervates the biceps, and also the muscles that turn the palm over, so that's in palm facing up. So with this one, it's really quite simple. What you're trying to do is take the arm behind you and take your thumb up. So you're trying to essentially supinate. So with this one, if you're thinking about it in terms of the position of your hand, your palm is going to face away from you. So again, so it's just taking the arm back up, and thumb goes up, palm faces away. And hopefully that should start to free it up. I hope you found this video useful, and if you did, please give it a thumbs up, like, and subscribe to my channel. And I look forward to seeing you on the next video.